Yes, okay. So I am also seeing participants have joined. A really good morning to everyone. And we are starting this weekend with very important topic, which is endocrinology, diabetes and metabolic disorders. Okay. So whenever we talk about diabetes, metabolic disorders, pre-preparatory, you pre-unit, this is a unit. Pre-unit preparation will require you to have an understanding about what is diabetes, how to diagnose it. Okay. So I think in your MBBS, you have studied what is diabetes. So this is something in your UG days, undergraduation days, you have been taught whenever blood glucose levels are more than 126 milligram percent, then it will be called as diabetes, or anything below, is borderline, but more than 126 will be considered diagnostic of diabetes. So when we talk about diabetes, it is something where there has been problem, that pathology. So first we will try to get an insight into types of diabetes, that is type 1 diabetes, type 2 diabetes, monogenic diabetes, or maturity onset diabetes of young. Okay, what is MODY? Maturity onset diabetes of young. Then we will also see metabolic syndrome, which is reconstruction or disruption between insulin resistance and adipose tissue, or adiposity, or adiposopathy. Okay, it is a pathological thing. That is why it is called as adiposopathy. We will see
Diabetes mellitus, more than just high blood sugar. It's a metabolic disorder driven by insulin deficiency or resistance. Result? Persistent hyperglycemia affecting every organ system. Often linked with metabolic syndrome, obesity, dyslipidemia, hypertension. These disorders share a common pathway, impaired energy metabolism. Long-term impact? Microvascular and macrovascular complications. Management requires glycemic control, lifestyle modification, and risk factor correction. Understanding metabolism is key to preventing disease progression.
Okay, so now we are understanding that diabetes and metabolic syndrome are different. In metabolic syndrome, metabolic factors are considered, and when they amalgamate together, then we get a metabolic syndrome. Okay, and this is happening because of pathogenic adipose tissue. Your sick fat is there, which is visceral adipocyte hypertrophy, diabetes risk diseases. Right? So as we have understood the pathophysiology, the metabolic syndrome, now coming to the drugs, what all pharmacotherapy we can just, so these are the certain tools which we have as a physician. Okay, we initially, when we identified insulin, we used to extract it from other pigs, rats. We used to extract it from there. So that was a glucose-centric model, okay, where you identify something as a high glucose and then you give them insulin. So that model we have now discarded. But yes, we have to understand that glucose-centric model has been discarded, and now we have better models where we are, trying to protect organs. Okay, so what first we have our SGLT2 inhibitor.
Pharmacotherapy is not just prescribing drugs, it's precision medicine in action. It involves selecting the right drug, dose, and duration based on pathophysiology. Every patient responds differently, age, genetics, and comorbidities matter. Understanding drug interactions is critical to avoid adverse outcomes. Dose adjustment is essential, especially in renal or hepatic impairment. Therapy doesn't end at prescription, monitoring defines success. Effective pharmacotherapy improves outcomes and enhances quality of life. Always align with evidence-based guidelines and clinical judgment. Rational pharmacotherapy reduces errors and optimizes care, because the right drug in the right patient at the right time changes everything.